had another news item we wanted to get to here. First of all, let me mention on vaccines that the news just broke that the Biden administration is planning on recommending a booster shot. So that would be for Pfizer, a third shot, or Moderna, a third shot. But I think it's Pfizer that they've been focused on in this, yes, by and large. I know Pfizer is the company that has been pushing for these booster shots. It makes them a lot of money, of course. And I don't want to weigh in too heavily here. The preliminary data I've seen is that this may be important, especially for the elderly, for those who are immunocompromised. But I did want to tell you that's the very latest, and we're going to research it or bring an expert on to tell you whether or not that really is justified, or whether this was sort of like a cave to big pharma and their scare tactics and propaganda.
From what I have seen, there is a case to be made around booster shots only for the elderly. In terms of what we see, the data out, once again, I am not a doctor, so please don't take medical advice from me. But my general perusing of the people that I trust say that a booster shot may be useful for those who are of elderly or immunocompromised. But as I understand it, this guidance, and this is per the New York Times that broke this morning, is that they recommend this to everybody in terms of 8 months after your second shot. And so, look, I personally just think this is going to add to more vaccine hesitancy. I think that the idea that people now need 3 shots instead of 2 shots seems pretty ridiculous, given that Moderna and Pfizer both have great protection against regular COVID, even against Delta. It's pretty good. And look, the death rates don't lie, people. I've said it a million times. You get this shot, you're not going to die from Delta. Will you get infected? Yeah, maybe. It's a cold or a flu. Okay, we live with that as a people. As long as you're not going to die, and as long as your grandma especially is not going to die, or your grandfather, the elderly, the immunocompromised, then look, I think we're good.
Right. So the preliminary data I saw, apparently they're looking closely at what's happening in Israel, because Israel's kind of ahead of us in terms of when people started to get vaccinated. So you're able to look at, okay, do these vaccines, their effectiveness wear off over time? And what that data is suggesting, according to the write-up I read, which is, I think, in the New York Times, is that, as you said, the effectiveness does start to wear off, even where is concerned severe illness and hospitalization in elderly populations and in immunocompromised populations. So keep an eye on this, and we will continue to do the research and make sure we bring to you, the best information we can possibly find.
Right.
The other thing that we wanted to talk about, though, is obviously vaccine hesitancy, big issue. We're kind of stuck. There has been a little bit of an uptick, especially as Delta has surged in areas where Delta has been, really ravaging the population. You have seen people starting to get vaccinated at increasing rates, which, it's sad that it had to come to that, of actually fearing for your life, for the life of your loved ones around you. But that is, in fact, where we are. So most of the media conversation about vaccine hesitancy is just pure contempt, right? It's just like they only care to talk about one population, which is white conservatives, and especially white conservative men. They completely ignore the data about how, for example, in New York, only 27% of young Black New Yorkers have gotten vaccinated. Basically, if you've gotten screwed repeatedly by government institutions in our healthcare system, there's a good chance that you're going to be a little skeptical of this vaccine. But there's been nothing but contempt coming from the media. And in particular, they have not focused on one really pretty obvious and just super practical reason why at least some segment of the population has not gotten vaccinated yet. It's not so much that they're vaccine hesitant, it's that they can't get a damn day off of their job so that they can go and get the vaccine and manage whatever the side effects, which for some people are very real, might be. Our great friend Jeffrey Stein over at, why did I call him Jeffrey? I never call him Jeffrey. Jeffrey Stein,
like that, Jeffrey,
over at the Washington Post. He did the research here and looked at the survey data, and about 2 out of 10, so a significant chunk of unvaccinated employees, according to Kaiser Family Foundation, said if their employer gave them paid time off, they'd probably get vaccinated. 3 vaccine clinic representatives also said he went and reached out to people and talked to them about what they're finding are the reasons that people aren't getting vaccinated. And they said that time off, that was a real issue, and one of a handful that they commonly hear from vaccine hesitant people. I want to give you one anecdote here so that you can understand, the reality people are facing and the costs and benefits that they're juggling here. Jeff talked to one 40-year-old who said he'd been working 60-plus hour weeks for months, no bump in his pay. He covers gaps he's a manager at a Subway, to cover gaps in the store's schedule. They've struggled to find workers. He would like to get vaccinated. He believes everyone should get it, but said he just hasn't had the time or mental space to do it. Quote, by the time I'm out of work, it's time to go to bed. He said he would have gotten the shot months ago if he'd been offered paid time off, but the store doesn't offer that benefit to get the vaccine or deal with the after effects or sick pay in general. He doesn't have health insurance either, and said he had not seen a doctor in years. Subway did not respond to a request for comment. So here's someone who is not attached at all to the healthcare system.
Yep.
Doesn't have a primary care physician who he trusts that he could go and talk to, or that, he would have easy access there. Can't get a day off of work, is worried about missing time if, okay, getting the shot is one thing, but then are you going to have a day where you don't feel up to being able to go into the workplace?
And he's a manager. He's not even a regular employee.
Right.
Yeah.
I mean, he makes $35,000 a year, so it's not like he's making a huge amount of money here. But this is the struggle that, we don't have paid time off in this country. And some employers, most white-collar employers, will give you the day off. You're a working class person at a restaurant, at a gas station, wherever. Very unlikely that they're going to give you the time off, certainly paid time off, to be able to go and get this done.
Yeah, your host. There's really no other way to say it. And I think that the same thing is very important about young Black Americans as well. Put this up there from the New York Times. 28% of young Black New Yorkers are vaccinated. And in general, what you see is a large amount of distrust. And what I have tried to point to is these Kaiser Family Foundation surveys, which is what Jeff's story is also based on, where they point out that 2 out of 10 of the unvaccinated say that they would fix it, or that they would get vaccinated if they had paid time off. And some people will say, oh, that's just not that many. At scale, that's millions of people.
That's a lot of people.
Millions of people. Hundreds of thousands of people. You take that 28 and you make it 35. You know what? That's a whole lot of people who probably live in intergenerational housing and are around their elderly relatives. Maybe their elderly relative won't get vaccinated. But these are the types of things where all we have to do, have some actual compassion for these people and just say, what's going on here? Tell me what's happening. I don't understand. It's okay if you don't understand. It's okay that you hold the position that you hold. And instead, just the hatred that we all see. And I'm pointing not just to white people who've been left behind, Black people, Latino, so many lower middle class folks who are rightfully distrustful of the entire system.
Wrong.
You see this booster shot thing? What are you supposed to think?
Right.
I was told I can take off my damn mask. Now I can't. I was in France where there's literal vaccine passports. You can't go out to eat, but they still have indoor mask mandates. What's happening? I actually have a certainty that I'm in a building where every single person is vaccinated.
Yeah.
And why do I still have to wear a mask? No one can explain these things to me, which is, again, why I am seeing this only harden amongst people who are vaccine hesitant. I know people, frankly, even people like myself, who are vaccinated themselves, who are looking at this booster nonsense and the mask mandates and more and being like, what the hell is going on here?
Well, and here's the other thing that is so galling is these media elites, the liberal ones in particular, they were the forcefully making the case effectively against Medicare for all in the Democratic Party. They don't give a shit about people's health until they're worried about them personally getting infected. So that's the other part of that is so disingenuous, is another obvious reason why we have a higher level of vaccine hesitancy here is the other aspect of this man's story is he doesn't have a primary care. He hasn't been to the doctor in years, okay? Mm-hmm. That's going to make you a lot less trustful of you don't have a person you can go to who can tell you here's the reality. I promise you it's safe. I've had many patients who have gotten it. They've been fine. You are disconnected from the medical system. And that's the other part that you're not going to hear about in elite media is there's a good reason that makes total logical sense of why you have a higher unvaccinated population here than you do in nations where they have a single-payer healthcare system and where everybody has a connection to the healthcare. That's not my crazy lefty point of view. That was what Michael Brennan Doherty from the National Review told us, okay? So it's so selective. They only care about like this one tiny sliver of people's health and of public health, and they care about it only with this one population that they want to like shame, and because it's not really about public health, it's about culture war. There's one other thing that we don't have a tear sheet for, but this is downright psychopathic. There's a doctor who they had on MSNBC who said it's time to start denying people who don't get the vaccine access to major medical treatments.
That's like a libertarian dream. Actually.
Liberal MSNBC, supposedly, right? They're saying we should deny people life-saving care if they don't get vaccinated. I mean, see, that is literally psychopath.
Let's play this game.
These are the same people who would claim they support universal health care.
Let's play this game. 40% of healthcare costs, almost 40%, are two things: dialysis and congestive heart failure, which are linked to what? Obesity. So should we deny fat people care in this country? Especially the uninsured fat are the people who cost us all a lot of money. Maybe even some of you are jokingly nodding at that. I say no, absolutely not. We should do that.
Or people who are smoking and getting like, where does it end? Where does it end? I mean, this is just, and you know what? I was really disturbed because I thought on Twitter, this is my naivete, that, you know, this was Raw Story, which is a liberal or progressive outlet. And everybody was in agreement. They're like, yeah, hate to say it, but that's what we should do.
Oh, that's insane. That is so insane.
And again, to talk about what we were just saying before, you're talking about disproportionately Black and brown communities.
Correct.
You are talking about denying care to overwhelmingly, this is a working class and disproportionately Black and brown population. Okay, 28% of young Black New Yorkers are vaccinated. That's it.
Yeah, so 70% of them should be denied health care.
The other 72%, you're saying they should be denied health care. Totally psychopathic. Just had to add that to the conversation, that's how insane these people have
I'm glad you are, because no, this is a legit, if they had the power, if you see what's going on in Australia, they would do that here, if they could do it. And this is what they're talking about. And where does it end? Many of these Black and brown Americans are the ones disproportionately more likely to be obese and to have comorbidities. So are you gonna deny them health care on those fronts? No. You know why? Because we understand that we have a lot of different problems in this country, and some people are worse off than others, and that, at least in terms of crisis care, that nobody is gonna die for want of health care. Generally. I'm not gonna say that that doesn't happen. And yet, this is complete callousness directed at the people who are most likely to suffer in our economic system, in our society.
Yeah.
It's just
And again,
outrageous.
coming from a group of people who claim to support healthcare as a human right.
Right.
Until the person that needs the healthcare in their mind is some like, you know, right-wing white dude, then screw him.
Yeah,
That's
correct.
That's the ethos.
Yeah, let him just
Major
die of a heart
card on
attack.
there.
That's super, very, very compassionate that we have of a country there.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.